talk a little bit about the use of antibiotics in livestock production, and it's one of the most misunderstood things going right now because we've got a lot of label claims and people trying to scare people off the use of or the consumption of food animal products and food protein. So understanding how antibiotics are used in food production, I think, is important. One misconception we have out there is that the antibiotics are being actually put into the meat in the final product, and nothing could be further from the truth because that's highly illegal to do that. So all antibiotic use in food producing animals is done in the live animal, and so it's used for the treatment of bacterial infections in an animal and utilized primarily and almost exclusively for the treatment of disease or infection of some kind. So as we look at how we use them and what that process is, the first thing we have to do is really diagnose what the problem is. If it's a viral infection, it's no different in animals as it is in people. Antibiotics have no impact on a virus. So that's the first thing we have to decide, and then at that point, even if it is viral, there is the chance of secondary bacterial infections because of the weakened immune system. So even though it may be a viral issue to start with, we've got to be prepared to treat a bacterial infection that follows that. So then we get into the situation of whether or not what antibiotic we use. I mean, there's a lot of antibiotics and different types of antibiotics on the market, and they target different pathogens. Some of them are broader spectrum, so we try to be as narrow in the spectrum as we can. But in a food animal, they can't have feedback to us. We've got to really try to diagnose what the problem is. So sometimes we use a little broader spectrum antibiotic than we might have to, just because we don't know exactly what pathogens we're fighting. The next thing is really how we deliver that product into the animal, and that is actually regulated by FDA. There's routes of administration that we have to adhere to. We also have to adhere to placement of the product. Some antibiotics are only labeled to be put in specific areas of an animal. Nearly all of them are going subcutaneous. There are some actually that have to be placed behind the ear because that's the only place that is approved by FDA. So once again, how we deliver that product into the animal is important because that affects how long it stays in the system, and that is a result of how long it actually took to get into the system and be effective. So how long we treat an animal is also specified on the label, and so if we can only treat it for 3 days with that product, that's what we have to adhere to. Now, a veterinarian can come in and change some of that and do what we call Extralabel prescription of these products, where we can go a longer length of time, a higher dose rate. But if we do any of that as a producer, we have to do so under the direction of a veterinarian and the instruction of a veterinarian. In part because that leads to the next part: how long do we have to withhold that animal from market to allow the antibiotics to clear their system? So that's one of the misconceptions out there about how long antibiotics are in there or how much antibiotics are in meat. The FDA has established withdrawal periods for every antibiotic, and that is the best estimate of how long it will take the animal to metabolize that compound in their system and excrete it as the metabolites. And so that's important to remember. We need to adhere to a minimum of that established withdrawal time. Some antibiotics will be completely eliminated from the system within that withdrawal period, and some of them just get below what we call a tolerance level, and that's a level that the FDA has deemed safe for human consumption. It may not be that everything is eliminated from the system, so that's where we as producers have to realize that even though we clear withdrawal times, there could still be a small amount of antibiotic left in the animal. And that's where extended withdrawal periods are the need for some people not to consume animals that have ever been treated with antibiotics. So we have to keep that in mind, as that's a very important part of this whole process. And it is illegal to sell an animal prior to them passing this withdrawal time. Now, if there's also a next step, the Food Safety Inspection Service at the packing plants where animals are processed inspect animals, and any suspect animals, they actually pull tissue samples to see if there's any residues left in those animals. So if there happens to be a condition that makes the veterinarian that's inspecting them think, well, that probably had been treated, they will actually pull samples to make sure there's no antibiotic violated residues in the animal. So that's just a safety aspect to follow up to what we as producers actually do. So in summary, it's proper diagnosis, making sure we're treating the right ailment with the right product. We use the appropriate compound, product selection, or combination sometimes, and follow a treatment protocol. Now, most treatment protocols are set up by the veterinarian specific to your operation and your production practices. And then the last thing is to adhere to those withdrawal times. The rest of it doesn't matter if we're trying to market an animal too early. So we have to make sure we select the right product, use it correctly, and then adhere to our withdrawal times before we market that animal to make sure we're delivering a safe, wholesome product to the consumer.